Good day, dear colleagues. Our lecture today will be about the pathology. We talk about surgical, anatomical and clinical pathology like the same discipline. Basic aims of our course is to know the main method of the clinical anatomical analysis of the biopsy and sectional material, understanding of the principles of the formulation of the postmortem diagnosis, technique of the cutting of the biopsy material, to know main pathonatomical documentation, understanding structure of pathonatomical services, which is in the integral component of the world system of the public health. Pathology, that is a branch of the medical science that involves the study and diagnosis of the disease through the examination of the surgical removed organs, tissues like biopsy samples, bodily fluids, and in some cases the whole body, autopsy. Aspects of the bodily specimen that may be considered include its gross anatomical makeup, appearance of the cells using immunological markers, and chemical signatures in the cells. Pathology also includes the related scientific study of the disease processes whereby the causes, mechanism, and extent of the disease are examined. Areas of the studies include cell adaptation to injury, necrosis, death of the living cells or tissue, inflammation, wound healing, and neoplasia. Pathologists specialize in the wide range of the disease, including cancer, and the vast majority of the cancer diagnoses are made by the pathologist. The cellular pattern of the tissue samples are observed under the microscope to help determine if a sample is cancerous or non-cancerous, like benign. Pathologists also employ genetic studies and gene markers in the assessment of the various diseases. Pathology, like term, it consists of the two parts. Pathos, Greek, like pain, suffering, and logos, study. It is a study of the process underlying disease and other forms of the illness, harmful abnormality, or dysfunction. Discipline is presently designated by this term in most countries has another names like pathological anatomy, pathomorphology, anatomic pathology, histopathology, morbid anatomy, surgical pathology, and so on. And this discipline can be subdivided into the several disciplines, as I said before. Histology. Samples of the bodily tissue and organs are prepared and examined in order to detect and diagnose disease. The architecture of tissue is observed at a microscopic level, and the relationship between the different cell and tissue types is examined. Cytology. Bodily fluids and tissue are examined at the cellular level in order to screen for and diagnose disease and help aid treatment decision. A cytology will examine how cells look, forms, and function. Forensic pathology. Forensic pathology is examination of an autopsy in order to discover the cause of death. The external appearance is first assessed to check for evidence of want of suffocation, for example. Surgical procedures are then begun and the internal organs are studied to see whether internal injuries exist and are connected to the external one. Using the various arsenal of methods, a modern pathologist usually can answer the question, what is disturbance, in what sequence, and in what cases it's developed, what outcome and complication take place. A modern pathomorphology necessarily includes the study of four main aspects of the disease: etiology, like cause of the disease; pathogenesis, mechanism which lead to the pathological changes; morphological changes, the structural changes of the cell, tissues, organs, and whole organism; and the clinical significance, the functional consequences of the morphological changes. Any clinical conditions based on the morphological changes. Clinical pathology can explain also, first, causes and mechanism of the death. We name it thanatogenesis in different diseases. Changeability of the disease, pathomorphosis. Pathology caused by the treatment, any medical procedures with the wrong tactics, iatrogenic pathology. Method of anatomical pathology. First, it's a biopsy. Biopsy is a taking of the small or big part of the living tissue from the living body for investigation and to know the correct diagnosis when the physician can understand the pathology of this disease. Second, autopsy. It's associated with the research of the dead tissue, organs, cells, products of secretion, or liquid taken from the dead body. So it's a section of the dead body. Experimental research, it may be different. We also in our department make some researches on the rats or on the pigs to know the main pathological changes which take place in the different organs, or maybe changes which caused by the treatment of this pathology, etc. Diagnostic techniques used in pathology. Pathology is used in the following technique to the diagnosis of the disease: histopathology, cytopathology, hematopathology, immunohistochemistry, microbiological examination, biochemical examination, cytogenetic, molecular techniques, and autopsy. Most diseases diagnosis based on the combination of these techniques. We are start from the cytodiagnosis, then histological examination. After that, we may add a lot of different techniques, like immunohistochemistry, for example. Immunohistochemistry based on the immune properties of the cell and tissue. Autopsy pathology. Autopsy, as we said before, it's a postmortem examination of the dead body. Autopsy learns not only diseases, but also some secrets of life. Not without the reason of the pediment of the section hall Sorbonne in Paris in the 14th century it was traced, the place where the dead delight to disturb the living. The main purposes of the autopsy: confirming the cause of death, establishing the final diagnosis, study of the therapeutic response to the treatment, organization of the work in the sectional with the sectional material. Dead bodies of the dying in the hospital, as a rule, are subject of the autopsy. What we must have? What is the main position? First of all, we must have official order of the head of physicians. All medical documents is delivered in the pathomorphological department together with the dead body. If the death take place in the second half of the previous days, so the documents must be sent in the pathomorphological department not later than 9-10 o'clock in the morning. Physicians should be present in the autopsy. During autopsy, pathologists should note details of examination and write down the important injuries. In every case of the autopsy must be complete and every organ must be examined. Even if the body is decomposed, autopsy should be performed as a certain important lesion may still be found. Abolition of the autopsy is not settled. In a case of the patient death, of which stayed in a hospital less than 1 day. In a cases of the requiring medical legal research, it may be traumas, car accident, or heart burns, or suicide, something like this. In a case of the death from the quarantines and extra hazardous infections, or maybe suspicion on them, like influenza or plague or cholera or maybe coronavirus. In all cases of not clearing diagnosis, regardless of the term of stay in a permanent establishment. In cases of the death after diagnostic instrumental research or any other medical procedures, or during them, or before them, or after them. Registration of medical documents. Establishment of the fact of biological death of the patient is made in the hospital by the physician. Time of death, write down in the medical history. The body of the deceased is accompanied by the documentation indicating the hospital, department, name of the dying person, date of the birth, date of the death, and the main clinical diagnosis. A dead body is delivered in the morgue. Bandages, drainages, endotracheal tubes, catheters remain on the place. There are two main methods of the autopsy: Rokitansky procedure and Virchow procedure. If we make an autopsy by the Rokitansky procedure, we remove all organs from the dead body at once. During Virchow procedure, each organ removed separately and immediately examined. Level of the autopsy. There are three levels: complete, limited, and selective. In a complete autopsy, all body cavities and all organs are examined. Limited may include the head. Selective, specific organs only examined. It's very rare. During autopsy, we make an external inspection and internal inspection. During external inspection, we must know the weight, height of the body. We write down the identificating marks like scars, tattoos, wounds, alga mortis, rigor mortis, postmortem patches, and maybe redistribution of the blood and other features of the biological death and postmortem changes. Internal inspection include the skin and underlying tissue are then separated to expose the rib and abdominal cavity. This opening allows the trachea, thyroid glands, parathyroid glands, esophagus, heart, thoracic aorta, and lungs can be removed. After removal of these, the abdominal organs are dissected free of liver, intestine, gallbladder, the bile duct system, pancreas, spleen, adrenal gland, kidney, ureters, urinary bladder, abdominal aorta, and reproductive organ. To remove the brain and spinal cord, the organs are separated and further dissected to reveal any abnormalities such as tumor or other. Samples are taken to be examined under the microscope. From all organs, we must take the small sample of tissue with a visual pathology or just parenchyma. The organ may be returned to the body after examination. Here you can see the autopsy procedure. On these slides, we can see the main instruments which used by the pathologists. First of all, it's a knife, rib knife or sectional knife, big and small. It's maybe scalpel sometimes. Scissors, different intestinal and the simple scissors, bone saw, rib cutters, and also hammer with a hook for the trepanation and removing of the brain. At the end of the autopsy, pathologists formulate the final diagnosis and cause of death. After autopsy, we design the medical death certificate, final or preliminary. A report will be done based on the notes and findings while performing the autopsy. Here you can see on the right side typical autopsy report. And what do we have in this report? First of all, it's include preamble with a date. Preamble, it's a name of the dead person, race, sex, age, home address, occupation, etc. Then, final clinical diagnosis. After that, the body of report include external inspection and internal inspection, like we talked before. After that, we write the histological research, which include microscopical description of the tissue samples taken from the dead body during the autopsy. Conclusions, which include clinical pathomorphological correlation, its epicrizis, pathomorphological diagnosis, postmortem diagnosis, and the death certificate. Structure of the postmortem diagnosis. As a clinical, the postmortem diagnosis includes three main positions. Its main disease or base disease, its complication, and accompanied disease. Main disease is considered that which itself or in the connection with the complication has caused death of the patient. Only nosological disease or its equivalent may be in main disease. Complications. Pathological process pathogenetically connected with the main disease and sharply changed its current, quite often causing not compatible with the life and striking the organ and system, bringing about death. For example, uremia in a case of the chronic glomerulonephritis, or bleeding in a case of the chronic peptic ulcer. In such events, of the complications emerge is the cause of the patient's death. Cause of death is a structural, functional, or metabolic injuries which lead to violation of the homeostasis and lethal outcome. Accompanied disease are a condition as a rule do not render unobserved influence upon the current of the main disease and are connected with it pathogenetically. Sometimes we have combined postmortem diagnosis. It's in the case when the patient has two or more nosological diseases, each of which can be referred to the main disease. It's classified into the three main types: rival, synergic, or cooperative, and background diseases. The rival diseases, when we have two very severe diseases, each of which taken separately is accompanied by the mortal complication or itself can bring death, each of the disease. Synergy disease or cooperative disease. It's a combination of the two or more diseases, each of which taken separately, if given time, not for life dangerously. However, in the aggregate, they burden and condition of the patient that can bring mortal complication. So that is the diseases which is not so severe separately, but it's when it's take place together in the one patient may lead to the death. Background disease. In a number of events, one of the revealed disease can play a main role in the region of the disadvantage current, up to the mortal outcome, made suffering through itself in given situation, and is not mortal. Such diseases are accepted to refer background disease in the group of. As such often emerge diabetes mellitus, atherosclerosis, hypertensive disease, and chronic alcoholic consumption. So, background disease is a condition which may lead to more severe duration of any other diseases. For example, diabetes mellitus lead to more severe aggressive duration of the phlegmonous appendicitis, or hypertensive disease also may lead to more severe complicated duration of the myocardial infarction. Death certificate. Death certificate is filled by the certificated doctor, like forensic expert or pathologist. In different countries, A form of death certificate has a different structure, but all forms include name of the dying patient, age, sex, date of the death and autopsy, place of inhabitation and death, states for determination the pathological process leading to death and establishment of the cause of death, examination of the dead body, autopsy. Cause of death is written down into two parts. The sequence of pathological process, disease or complication of the disease, directly resulting in the death, is specified on the first part. In the second part are other important states leading to death, but unconnected with the disease or pathological state. Here you can see the scheme of the death certificate formation. The first part: enter the disease, injuries or complication that cause the death. Do not enter the mode of dying, such as cardiac or respiratory arrest, shock or heart failure. List only one cause on each line. It's divided into the A, B, C, D. A. Immediate cause of the death, final disease or condition resulting in the death. B and C and D, it's a sequentially list condition, if any, leading to immediate cause. Enter underlying cause last. Disease or injury that initiated events resulting in death. It's mean if the patient have a myocardial infarction, which lead to the myomylation and rupture of the wall of the left ventricle, and then finally lead to the hemopericardium, means tamponade of the heart and heart arrest. We put the tamponade like end result into the A, rupture of the wall of the left ventricle into the B, like intermediate step, and C, it will be acute transmural infarction, which start the process. And the second part, other significant conditions contributing to the death, as I said before. Principles of the comparison of the clinical and pathomorphological diagnosis. During comparing of the clinical postmortem diagnosis, there are questions referring to the examination of the patient, timeliness of the determination of diagnosis, timeliness and correctness of the medical administration, to the cause of the mechanism of the death, and quality of the medical documentation. Comparison of the clinical and postmortem diagnosis. There are a lot of different positions. First, regarded as a wrong structure of clinical diagnosis, when a company disease appears as a main but main one put on the place of the company disease. If the clinical diagnosis presents itself only a list of symptoms and syndromes without separation of the main disease and insufficient use of the international classification of the disease. For the first position, when the company disease put as a main, it's mean that the clinically doctors decide that the main disease is ulcer of stomach, but the patient died because of the myocardial infarction. It's possible. If clinical diagnosis presents itself the list of symptoms, it means that we have no nosological unit, we have no normal fixation in the international classification of the disease. During comparing the clinical and postmortem diagnosis, it is necessary to take into account on the diagnosis on the card of face of medical history, not other one. At a polycausal or combined main disease, an absence of the wrong name of the one of the disease is considered as a divergence of the diagnosis. If a disease recognized on section as main disease at life was regarded as accompanied or background one, clinical diagnosis is wrong. Also, it's wrong when it's not recognized one of the rival combining disease. Diagnosis of the main disease must be sufficiently explicated. It is necessary to take into account that malignant and infectious disease can appear sometimes in the rubric of accompanying disease. Oncological patient can die on the myocardial infarction. Often, the patient may develop a persistent structural and functional disorder as a result of surgical operation. Commissural disease, insufficiency of the anastomosis in sutures, stricture of the urinary or biliary system, deficiency anemia, etc. Such removed consequences, which we name second diseases, should be considered as a main disease, and those diseases that cause the first operation are background ones. Sometimes, during the patient's stay in the hospital, a new acute disease may develop, pathogenetically unrelated to the previous one, which may be the cause of the death. The patient which hospitalized with dysentery then develop acute phlegmonosal appendicitis with peritonitis, for example. The medical action caused for the patient death was undertaken on the wrong diagnosis. In the similar cases, this action, operative diagnostic reaction on the drugs or other, is put in the place of the main disease in the pathomorphological diagnosis, with accordance to the international classification of the disease. The medical action caused for the patient death was undertaken in accordance with certain evidences, but was released wrong, as has brought patient to death. Transfusion of the average uncompatibility blood, administration of the lethal dose of the intensive remedies, etc. Similar cases usually are the subject of the judicial medical expert procedure. In the pathological anatomical diagnosis, they must appear on the place of the main disease. The medical action causes death for the patient was undertaken rightfully and realized correctly by disadvantage influence for the connection with the individual idiosyncrasy or with the severe condition of the patient and indication of the disease. What is impossible was defined beforehand. If the case is similar, medical action must be included into the group of complication. Consequently, at the analysis, it is necessary to distinguish two categories of complication: complication of the disease and complication of the treatment. Coincidence of diagnosis of the main disease is formal when undue diagnostic has brought about the wrong treatment. Final clinical diagnosis is ungrounded if it is turned out to be explained, not resulting from the clinical records and results of laboratory and other tests, when from records in medical history it is difficult to realize is development diagnostic thoughts. Divergence of the main clinical and post-mortem diagnosis can be, according to types, nosological, etiological, and localization. Nosology, it's mean diagnosis of tuberculosis of the lung instead of the cancer of the lung. Etiology, the wrong etiology, diagnosis of the tuberculosis meaning tuberculous meningitis instead meningococcus 1. On the localization, divergence, it's a diagnosis of the cancer of stomach instead of the cancer of pancreas. The original and reason of divergences of diagnosis can be objective and subjective. Objective reasons. It's short presence of the patient in the medical institution. Difficulty of or impossibility of its examination because of the severe condition of the patient. Unusual development and current of the disease or insufficient study of the disease. Subjective reasons are stimulated by the level of the qualification of physician. It may be incomplete clinical examination, wrong interpreting of the clinical data, underestimation of clinical and anamnestic data, underestimation of reassessment of laboratory, X-ray examination or cytological tests, reassessment of specialist consultation and of the patient, and wrong wording of the clinical diagnosis. At the analysis of the reason of divergences, it is also indicated on what stage of examination of patient was not installed diagnosis. Categories of divergences are classified into the three. First is less severe. Disease was not recognized on the preceding stage and in the hospital because of severe condition and short presence of the patient in the hospital. It may be severe oncological patient with a gonal period or final stage of rheumatic disease or uremia, etc. Second, categories of divergences. Disease was not recognized in the hospital, however, wrong diagnostic had no deciding influence upon the mortal outcome. Whereas patient has entered in that hospital in incurable condition. Patient with several severe diseases with torpid they are current. Patient in the final phase of the chronic heart failure, hepatic insufficiency, etc. Third, more severe category. Diseases which was not identified in the hospital lead to incorrect medical tactics, which played an important role in the deaths. This group includes all urgent cases requiring immediate radical medical care, like acute destructive appendicitis, pancreatic necrosis, perforated stomach ulcer, strangulated hernia, acute myocardial infarction, cerebral stroke, Croupo's pneumonia, and other acute infections. Clinical morphological conferences. Analysis of divergences in a clinical morphological diagnosis is discussed in the clinical morphological conferences. Clinical morphological conferences is important for widespread discussion of the complicated, intricate cases with the divergences in clinical and postmortem diagnosis. This conference can be conducted in department, hospital, town. The main reporters is clinical morphological conference are chairman, clinician, pathologist, and reviewer. Clinical reports medical history of patient, treatment, clinical diagnosis, clinical epicrizis. Pathologist reports morphological changes in anatomy, anatomical diagnosis, clinical morphological epicrizis, category of divergence in clinical and morphological diagnosis, postmortem diagnosis and causes of the clinical mistakes. Reviewer informs about known and rare medical literature of this disease. Clinical morphological conference instructs clinicians, physicians, and pathologists not perform similar mistakes, assist to increase qualification. Thank you very much.